Namaste. Myself Dr.N.H. Kulkarni, presently working as Principal and Head of the Department of Shalya Tantra at Bhagavan Mahavir Jain Ayurvedic Medical College, Gajendragarh, Karnataka. Today I am going to introduce the subject of Shalya Tantra. So Shalya Tantra is one of the branch of Ayurveda, and we know what is Ayurveda. Ayushaha Vedaha Ayurveda. It is science of life. We also know that Ayurveda has been came to earth in 8 distinct branches. So these 8 branches of Ayurveda are called as Ashtanga Ayurveda. So why our acharyas have divided Ayurveda into 8 branches? The reason for that is the forthcoming generation on this earth will be having Alpa Ayu, that is short lifespan, and Alpa Meda, that is declining intellectual capacity. So because of these reasons, our acharyas have divided Ayurveda into 8 distinct branches. Now we can consider them as 8 specialities of Ayurveda. Shalya Tantra is one amongst the important branch of Ayurveda. So the definition of Shalya and Shalya Tantra we have to look into. Shalya is the subject of this particular branch of Ayurveda, that is Shalya Tantra. Shalyam adhikritya kritam tantram Shalya Tantram. It means the branch of Shalya Tantra deals with the means and methods of removal of different types of Shalyas. And Drona is very important disease in Shalya Tantra because without creating wound, there is no surgical treatment. A surgeon should know how to create wound and how to heal it. So Shalya Tantra also deals with the different methods of diagnosis, prognosis, and management of various surgical, medico-surgical, and medicinal diseases. Shalya Tantra can be broadly compared with that of general surgery. So why Shalya Tantra is very important branch of Ayurveda? Because it is the first branch of medical science which was in practice since beginning. Shalya Tantra also explains about management of various traumatic injuries and scope for usage of yantras, that is blunt instruments, shastras, that is sharp instruments, kshara, that is alkaline medicaments, and agni, that is thermal power. So these are the different modalities which can be used in the domain of Shalya Tantra, which other systems of Ayurvedic branches do not have. They have got only one modality, either through Bheshaja they have to tackle the diseases. Whereas in Ayurveda, Ayurvedic surgery, we have got different modalities of management. So therefore, Shalya Tantra has to be considered as one important branch of Ayurveda. So it includes the subject of other branches and it is common in other branches of Ayurveda. So Shalya Tantra principles are there in other branches of Ayurveda. If you look into the management of various diseases in other branches of Ayurveda, the principles of management of Shalya Tantra are there. So if you look into the subject of Kaumar Bhritya, we do get the principles of management of Shalya Tantra. If you look into the Prasuti Stri Roga, there also we do get the principles of management of Ayurvedic surgery. If you look into Kaya Chikitsa, there also we do get some of the principles of management of surgery. And at the circumstances, Acharya Charaka has told Tatra Dhanvantariyana Madhikara, this highlights that there is a role of surgeons for the management of that particular ailment. So the other reason why Shalya Tantra is important is it has got benefits such as Ashukriya. The results which obtained by this modalities of management of Shalya Tantra are very quick result yielding and they are Shashwata, they are permanent. It, it gives Punya, it gives Swarga, means salvation after death. It gives success, that is Yasha. It gives Ayusha, it longevity. It gives Ruttikara, professionalism. So we will get expert in our profession. So because of these reasons, Shalya Tantra is to be considered as important branch of Ayurveda. Not only this, there are few more reasons why Shalya Tantra is to be considered as important. So that is the why Shalya Tantra is important branch. So Shalya Tantra, the historical background, if you look back to the history of Shalya Tantra, we do get various examples that Shalya Tantra was at its golden period. So the transplantation of head of Lord Ganapati by elephant's head, the transplantation of leg of Queen Vishfala by metallic limb, the transplantation of head of Daksha Prajapati by goat's head. So these are the examples which shows the golden period of Shalya Tantra in ancient time. So another important concept which was there in ancient time in Shalya Tantra was Madhuvidya. That is what is called as organ storage and transplantation. Acharya Dadichi is considered as father of Madhuvidya. And we do get the references of craniotomy, that is the removal of brain tumor and parasites from the brain through craniotomy. We do get the details of plastic and cosmetological surgery in ancient science. So in Sutrasthana of Sushruta Samhita, there is one chapter which is Sandhana Karma Vidhi Adhyaya, where Acharya has explained the detailed explanation of Sandhana Karma, and we do get the explanation regarding Vaikrutapaha Chikitsa, that is correction of defects of healing. So these fall under plastic and cosmetological surgery. We do get the references of laparotomy in our ancient literature. We do get the abdominal surgical procedures for intestinal obstruction, that is Baddha Gudodara, and perforation, that is Chidrodara, in more detail. So this is the photograph of Acharya Sushruta, and the period of Acharya Sushruta is to be considered as golden period or golden era in the field of Ayurvedic surgery, and Acharya Sushruta's contribution to the field of surgery is very abundant and very detailed, and hence Acharya Sushruta has to be considered as father of surgery, and Sushruta Samhita is to be considered as the first and the best recorded compendium on surgical procedures. And there are certain basics of Shalya Tantra which are there in Sushruta Samhita, and they are the dissection of human cadaver has been explained by Acharya Sushruta in great detail, and some of the highlights of this human cadaver dissection are Acharya Sushruta has explained how to select the body, how to preserve the body, and the methodology of dissection of human cadaver. And regarding applied anatomy and physiology, Acharya Sushruta has explained the concept of Chatkriya Kala, concept of inflammation. This is very, very important to understand any particular disease with inflammatory pathology and to plan the management of the diseases at various pathological stages of uh, consequences. So, Vrana Ropana, that is wound healing, is very important topic in Sushruta Samhita, and Acharya has explained it in great detail. So there are 60 modalities of management of wound and ulcer, which is known as Shashti Rupakrama. So regarding clinical aspects in Shalya Tantra are which has been explained by Acharya Sushruta. Acharya Sushruta has explained the detailed surgical armamentarium, which includes yantras, that means blunt instruments, shastras, that means sharp instruments, aushadhis means different types of medicinal formulations, and bandhas are the technique of the bandaging, art and science of bandaging. And Acharya Sushruta has also explained various surgical procedures under the caption of Ashtaveda Shastra Karma. So, under these 8 different surgical procedures, starting from the main surgical procedure to the post-operative procedure, everything has been incorporated. And Sushruta has also given importance for parasurgical procedures. The main important parasurgical procedures are Kshara Karma, that is the use of caustics for the management of diseases, Agni Karma, that is the use of thermal power for the management of diseases, Rakta Mokshana is nothing but the bloodletting. There are various techniques of bloodletting which have been explained in great detail in Sushruta Samhita. And the expert of Shalya Tantra was being called as Shalyavid, that is the surgeon. And Acharya Sushruta has explained what are the qualities of surgeon in ancient time. So even today, these qualities are ideal and desirable to become a surgeon. So Shauryam, that means the surgeon should be a courageous. Ashukriya, he should be having swiftness of action. Shastra Taikshnam, he should handle the sharp instrument with a lot of delicacy. Asvedam, he should not perspire much. Avyapatu, he should not be having any tremors, he should be free from tremors. And Asammoha, that is, he should be free from confusion. There should not be any confusion in the field of surgical treatment. And in modern surgery, the qualities of surgeon which are explained as lion's heart, eagle's eye and lady's touch. Lion's heart is nothing but he should be courageous. Eagle's eye, that means he should be able to visualize keenly the pathological and non-pathological tissues, and lady's touch is indicative of the delicacy in handling the tissues. And Acharya Sushruta has also explained the practical training under the heading of Yogya. In Sutrasthana, he has contributed one full chapter, that is Yogya Sutriya Adhyaya. So, regarding Dhanvantari, many of the people will think that Dhanvantari is god of Ayurveda, but here in the field of surgery, Dhanvantari is the term which is derived from the root word Dhanu, which means Shalya Tantra, and the person who is well versed in Shalya Tantra is to be considered as Dhanvantari. It means Dhanvantari refers to surgeon. So with this I conclude my talk, and I will make one more talk on another important topic of Shalya Tantra. Thank you.